My name is Gwendolyn Jackson. I'm from Houston, Texas. I used to be a case manager. I used to house homeless individuals. I'm a founder and CEO of a nonprofit organization, the Roy L. Jackson Community Outreach Center, and I'm also part of an organization they call Survivor. When I would go for my well woman exam and I would tell my doctor, hey, I'm having heavy cycles, I'm back pain, bloating in the stomach. He said, I think you have steroids. It's very common in the African American community. That's what it sounded like to me. We'll run some more tests. And then I kept having like symptoms. So I went to my mother because I'm that girl that think mom can fix everything. So I was like, hey, I'm having, very heavy cycles. I don't know what's going on. The doctor said he's going to run some tests. He haven't called me back yet. And she said, you're going through premenopause. I went through the same thing, same age, just premenopause. So cycles wasn't getting any better. So I finally went to my doctor and he ran tests and he did the HPV test. My HPV test came back negative. So he was like, okay, um, my pap smear came back negative. So it wasn't that my doctor didn't do his job. We don't know how everything just went through, and I was one of the ones that, hey, this happened to. So he did everything. He ran all the tests, he did everything. So I was still having symptoms. So what he said, hey, I'm gonna do an ultrasound on you. He did an ultrasound, um, just a regular ultrasound. Um, and he said, I see fibroids. He said, so I recommend that we might have to do a hysterectomy because you have fibroids. I was at work and I started leaking from my vagina. I was leaking clear fluids. And I have had kids before. So I was like, I'm too old. I know I'm not pregnant. Um, so because it almost felt like my water bag would burst. That's how the fluids was leaking. So I was like, okay, now this is not good. So I went to the emergency room and I wish I could remember the doctor name that really saved my life. When I went to the emergency room, I went to the emergency room and it was an older doctor there and he said, hey, I'm like your doctor, there are fibroids. But it was a young doctor there that just became a doctor. And he said, hey, I want to run some more tests on you. I just don't feel comfortable with everything you have told me. He said, hey, what can we lose? Let's do an MRI. So he ran an MRI. He came back and he said, I see fibroids, but I see something under the fibroid. He said, so I'm going to have to send you to a specialist. uh, a gynecologist specialist so they can run more tests because I'm not sure. But he put on my paperwork cervical cancer. So I went home. That was the worst thing to do. I got on the internet. I was searching cervical cancer, and my father passed from cancer. And I was already a daddy's girl grieving. So when I saw cervical cancer written on that paper, I lost it. I was like, oh my God, do I have cervical cancer? He wrote it on the paper before they even found out I had it. So I go to the specialist. The specialist tell me we got to run a biopsy. Calm down. She was like, don't worry. You're pretty healthy. I see all the test results they have done. I don't think you have cervical cancer. It might just be the fibroids. He's missing it. So they did a biopsy. I went in there thinking I just had fibroids and left cancer. And it's like when you first hear you have cancer, I don't know if you ever watched Charlie Brown when it's like, and you cannot, it's like it's not registering. And I thought, not me. For some reason, I thought I was exempt because I was running a cancer organization already. I was helping people with cancer. I started my nonprofit in memory of my father who died from lung cancer. So I was like, I eat right. I was I was running like 5 miles every morning. What did I miss? I don't smoke. I don't drink. They did a full hysterectomy. They said, hey, we're gonna go in. we can take it. We can take the whole tumor. They gave me, before they said, hey, after we take the whole tumor, you'll do radiation. That's it. Your life will be back to like it was. That's what I thought. December the 17th, I went in for the full hysterectomy. They found out it was 9 centimeters. They found out that I was before I went in, they found out I was stage 3B going in because it was in my left lymph nodes. So, but they were still telling me, you'll be fine, radiation and all of that. Well, after we removed the tumor, radiation would take care of everything else. So I was like, okay. After the 6 to 8 weeks where I could go to radiation, I went to radiation. My doctor, for some reason, did some blood work on me, and he was like, I'm concerned with the blood work. And I was like, what? He was like, the blood work never changed. Something is not right. He said, okay, I'm going to do a MRI and a PET scan. We got to see what's going on. So when they did that, they found out that my cancer spread it to my pelvic, um, the bone, my hip bone, my legs, all in that short period of time, and on my spine. So just imagine from going to everything's going to be okay to find out now they tell me you got 16 months to live. I didn't want a port. I didn't want a port. I was like, okay, can we figure out something? Is it a way that I can do pills or whatever? So my treatment was pills. I did chemo pills. Um, I did chemo pills and I did radiation. Um, the chemo was so hard on me. I had every symptom you can have. And I remember I used to, be telling my dad, come on, you can eat, come on, you can get out of bed. Now I understand. Some days you can't get out of bed. Some days you don't have an appetite. No, you don't want to eat. You look at food and you get nauseous. So people don't understand that. Like, it's not that we don't want to. It's like, I'm trying. I'm showing up every day. I'm doing the best I can. I couldn't keep anything on my stomach. I I was vomiting, diarrhea. I was weak, and they was giving me medication for everything. Nothing was working. I was numbness of my fingers and my feet. Um I was, oh my God. Um I just always felt so weak and cold all the time. Like now, I always have a heater with me, but I was so weak. I didn't think I was gonna make it. And even my doctor, he was saying, because I lost so much weight and I wasn't strong. He was like, you getting weaker and weaker. Well, the thing is, the clinical trial never got brought up. I brought the clinical trial up. So what I did, I met this doctor that I told you I met at one of Survivors retreat. I met this doctor and she was different, if that makes sense. I knew that she really cared about people. And Dr. Jan was like, hey, when you get back to Houston, let's stay in touch. Because she worked at MD Anderson. I was like, well, my treatments are not at MD Anderson. So I said, let me ask about the clinical trials. But I want to know when I go in and ask, I want to have information. I want to educate myself about it. So that's when I reached out to Dr. Jan at MD Anderson and asked her about it. And she gave me all this information, told me which one she recommend, send the email over right away. Clinical trials was free, so that's the good thing. It's free. It was free for me, so that was the good thing. So what they have to make sure that everything line up. Like, is it the if this will this be a fit for you? My dad took clinical trials at the end, and it was just like I was like, y'all not helping him. I was a daddy's girl. So I'm like, this is not helping him. But my dad was such a just a great guy. He was like, hey, this how they'll find out if it worked for someone else. And he was like, if it don't work for me, they know it don't work. They. And if I can help someone, that's what I want to do. I want to help someone. So when you get, I didn't understand at that time because I wasn't a patient. But when you become a patient, you feel that way. You're like, okay, if it don't work for me, we know we have to try something else. So, and if it worked for me, that means we can help. This could be it. So if I have to go through all of this to make sure it can save me and someone else, it's so worth it. When I went to MD Anderson, they had to do all their scans themselves. They had to make sure everything my doctor was saying was true. So they don't just get your paperwork and say, okay, he said you have cancer, so we gonna go through. We gonna stick with this. No, their team come in and they have a team for everything. Oh my God, they have a team for okay. This the bone cancer specialist. This the bone cancer doctor. This is cervical cancer doctor. This is everything. So when they coming in and they speaking with you, everybody is a specialist and they specialize just in that. So that's what I do like. So even though I had cervical cancer, they had like, hey, we have the cervical cancer doctor, but we have the bone cancer too, because since it's in your bone. So what they did all their tests, all the tests I already had, they did everything over to make sure what they had in the fall match. The clinical trial I'm on now, I think it's called INNOVA, INNOVA TB 301. Um, and it's trial phase 3. I take the shot, the target therapy drug shot too. And then you just that's what I take for treatment. And then of course they give me stuff for nausea and all that type of stuff too. I like the clinical trials better than I like the chemo. It's not so hard on my body. I like that. It's not so hard on my body. Um, do we know if it's working now? Well, the thing is, they said, I don't know if they think it'll work. They saying buying me more time. So if that's what it can do, I'm okay with that. I'm still alive because of clinical trials. In the African American community, clinical trials are frowned upon. Um, I think it goes back to um, when they was using African Americans for experiments and really being the guinea pig. So now in our mind, we still think we are the experiment or the guinea pigs, or a lot of black women or brown women when it comes to the medical team, sometimes we feel like we're not being heard because I feel like my doctor wasn't hearing me at first when I said, no, it's not fibroids. Something is going on. But they kept pushing me off, not being heard. So it's already, uh, but I'm going to say this. I thought it was just black women that go through that. For me, being in the teal and white community, being in survivor community, and we chat with each other, it's just us as a whole, as women. They're not listening to us. The advice I would give is someone told me this, my doctor, where Dr. Jan said, when you go into the doctor's office, they are working for you. You are not working for them. So when you have that in mind when you're going in, it's different when you know that, hey, you're working for me, so it's okay to use your voice. If you feel like something is not right, speak up. If this a treatment that you don't want to do, say that.